you can have access to something and not utilize it. If you have access to bariatric surgery, but there's so much stigma surrounding this and you're afraid to go in, even for the initial consultation, that to me is one of the biggest problems that we have right now in 2025 is we have this amazing, life-changing, saving operation that we know works, and 1 to 1.5% of people with coverage actually use it. If you actually look at insurance coverage across this country, over 90% of Americans have access to metabolic surgery, which is just staggering. Like we only have about, less than 10% of the country without access to surgery. So why do only 1 to 1.5% use it? And I truly believe the biggest reason is the stigma attached to it. And I'm incredibly vocal and open about my own struggles with obesity. And, after having 2 babies, I could not lose my weight. I went on tirzepatide, and I have publicly at podiums told people about my weight loss journey. And I think that once we get even physicians to stop shaming themselves, because I have a lot of shame, even as a person who's boarded in this specialty, it's still like you're a little embarrassed to tell people I'm on a medication for weight loss. Like no one ever wants to talk about that. But until we all do, and we openly address the stigma associated with this disease, we're really not going to move that needle on utilization, which I truly think is probably the most important needle to move right now.